Dr. Bayrak, what is pelvic inflammatory disease?
Pelvic inflammatory disease is infective disease of the female genitalia. Pelvic inflammatory disease can include a variety of disorders that can be certainly an infection in the cervical area, or it can involve the cervix and it can go up into the uterus and into the fallopian tubes. The pelvic inflammatory disease is oftentimes not diagnosed well. It may be asymptomatic with the presence of an STD such as gonorrhea or chlamydia infection. And chlamydia infection is known for its silent course in about 70 to 80% of the time, or of the infections. Anyway, you get the infection and maybe you have cramping or no symptoms at all, and then the damage is done and you don't know about it until you start trying and it doesn't work, and you go to an infertility specialist and they do a workup. Like, let's say they check your hormones, and then they check the male sperm, and then they check your fallopian tubes, and all of a sudden the fallopian tubes are blocked. One side is blocked or both sides are blocked. And then you go back and ask the patient, well, did you have an STD or anything? And the answer is generally not really, no. And that's because most of the infections, majority of the infections are asymptomatic. And that constitutes most of the cases in the population. Now, if somebody has one-time pelvic inflammatory disease or a sexually transmitted disease, and then it heals, and then the patient is, let's say, not trying to conceive, and then she has another STD or pelvic inflammatory disease for that matter, well, the risk is much higher in that case, isn't it? So with 1, 2, 3 PIDs, pelvic inflammatory disorders, diseases, the risk goes up in terms of having tubal disease and infertility, of course, down the line with increase in the pelvic inflammatory disease episodes. So that's significant.